Living with Parkinson's disease can be a challenging journey, but there are medical treatments available that can greatly improve mobility and quality of life. One such treatment is Sinemet, a medication specifically designed to manage the symptoms of Parkinson's disease and provide relief to those who experience tremors, stiffness, and difficulty with movement. With its unique combination of Carbidopa and Levodopa, Sinemet helps to replenish and regulate dopamine levels in the brain, allowing individuals with Parkinson's to regain control over their motor functions. In this video, we will explore the benefits of Sinemet for Parkinson's disease and discuss how this medication can help individuals navigate their journey to better mobility. From its mechanism of action to the potential side effects and considerations for use, we will provide comprehensive information to help you make informed decisions about your Parkinson's treatment options. Understanding Parkinson's disease and its effects on mobility. Parkinson's disease is a neurodegenerative disorder that affects the central nervous system. It is characterized by the loss of dopamine-producing cells in the brain, leading to a disruption in the transmission of signals that control movement. As a result, individuals with Parkinson's often experience symptoms such as tremors, muscle stiffness, bradykinesia, slowness of movement, and postural instability. These symptoms can have a significant impact on mobility, making it difficult for individuals with Parkinson's to perform everyday tasks and maintain their independence. Simple actions like walking, getting dressed, or even turning in bed can become challenging and exhausting. This loss of mobility can have a profound effect on a person's quality of life, leading to frustration, depression, and social isolation. How Sinemet works to improve mobility in Parkinson's patients. Sinemet is a medication that combines two active ingredients, Carbidopa and Levodopa. Levodopa is a precursor to dopamine, a neurotransmitter that plays a crucial role in regulating movement and coordination. By increasing the levels of Levodopa in the brain, Sinemet helps to replenish the depleted dopamine levels and restore the normal functioning of the central nervous system. Carbidopa, on the other hand, enhances the effectiveness of Levodopa by inhibiting the enzyme that breaks it down in the bloodstream before it reaches the brain. This allows a higher concentration of Levodopa to reach the brain, resulting in more significant symptom relief. The combination of Carbidopa and Levodopa in Sinemet provides a powerful tool for managing the symptoms of Parkinson's disease and improving mobility. By restoring dopamine levels, Sinemet helps to reduce tremors, stiffness, and slowness of movement, allowing individuals with Parkinson's to regain control over their motor functions and perform daily activities with greater ease. The benefits and potential side effects of Sinemet. Sinemet offers several benefits for individuals with Parkinson's disease. Firstly, it can provide significant relief from the motor symptoms associated with the condition, allowing individuals to regain their mobility and independence. This improvement in motor function can enhance quality of life, enabling individuals to engage in activities they might have previously struggled with, such as walking, writing, or cooking. Sinemet is also known to have a rapid onset of action, with many patients experiencing symptom relief within 30 minutes to an hour after taking the medication. This quick response time can be particularly beneficial during episodes of OFF periods, where symptoms suddenly worsen and mobility becomes severely impaired. However, like any medication, Sinemet does come with potential side effects. Common side effects include nausea, dizziness, and headache. These side effects are usually mild and transient, but if they persist or become bothersome, it is important to consult a healthcare professional for guidance. Additionally, long-term use of Sinemet can lead to dyskinesias, which are involuntary movements that may occur as a result of prolonged exposure to Levodopa. It is important to work closely with a healthcare provider to find the right dosage and balance to minimize these side effects. Dosage and administration guidelines for Sinemet. The dosage of Sinemet will vary depending on individual needs and the severity of symptoms. It is typically started at a low dose and gradually increased under the guidance of a healthcare professional to find the optimal dose for symptom control. The medication is available in various strengths, allowing for flexibility in dosing. Sinemet is typically taken orally, and it is important to follow the prescribed dosing schedule. It is recommended to take Sinemet on an empty stomach or with a light meal to enhance absorption. However, certain foods, especially high-protein meals, can interfere with the absorption of Levodopa, so it is advisable to consult a healthcare professional or pharmacist for specific dietary recommendations. It is important to take Sinemet exactly as prescribed and not to make any changes to the dosage or schedule without consulting a healthcare professional. Abruptly stopping or changing the dosage can lead to a sudden worsening of symptoms or other complications. Regular follow-up appointments with a healthcare provider are essential to monitor the effectiveness of the medication and make any necessary adjustments. Tips for managing Sinemet treatment and maximizing its effectiveness. While Sinemet can be highly effective in improving mobility for individuals with Parkinson's disease, there are several tips and strategies that can help maximize its effectiveness and manage potential side effects. Consistency is key. Take Sinemet at the same time every day to maintain a consistent level of medication in the bloodstream. This can help minimize fluctuations in symptom control and prevent off periods. Keep a symptom diary. Tracking your symptoms can help you identify patterns and determine the most effective dosage and timing of Sinemet. This information can also be valuable during follow-up appointments with your healthcare provider. Be mindful of dietary considerations. Certain foods can interfere with the absorption of levodopa, so it is important to be mindful of your diet. Consult with a healthcare professional or pharmacist for specific dietary recommendations. Stay hydrated. Adequate hydration is important for the optimal absorption and effectiveness of Sinemet. Make sure to drink enough water throughout the day to support its action. Avoid sudden changes in position. Sinemet can sometimes cause dizziness or low blood pressure, especially when standing up quickly. To minimize these effects, try to avoid sudden changes in position and take your time when transitioning from sitting to standing. Communicate openly with your healthcare provider. It is important to have open and honest communication with your healthcare provider about your experience with Sinemet. If you are experiencing any side effects or if you feel that your symptoms are not adequately controlled, do not hesitate to reach out for guidance and support. By following these tips and working closely with your healthcare provider, you can optimize the effectiveness of Sinemet and enhance your mobility and quality of life. Lifestyle changes and complementary therapies for better mobility with Sinemet. While Sinemet can be highly effective in managing the symptoms of Parkinson's disease and improving mobility, there are also lifestyle changes and complementary therapies that can further enhance its benefits. These strategies can be used in conjunction with Sinemet to support overall well-being and maximize mobility. Exercise regularly. Engaging in regular exercise, such as walking, swimming, or Tai Chi, can help improve strength, flexibility, and balance. It can also enhance mood and overall well-being. Consult with a physical therapist or exercise specialist to develop a personalized exercise program that suits your abilities and goals. Physical therapy. Working with a physical therapist can provide valuable guidance and support in managing Parkinson's symptoms and optimizing mobility. Physical therapy can include exercises to improve strength, balance, and coordination, as well as techniques to manage specific symptoms like freezing or gait difficulties. Occupational therapy. Occupational therapists can help individuals with Parkinson's disease develop strategies to manage daily activities and maintain independence. They can provide advice on adaptive equipment, home modifications, and energy conservation techniques to make daily tasks easier and safer. Speech therapy. Parkinson's disease can affect speech and swallowing function. Speech therapists can provide exercises and techniques to improve speech clarity, swallowing coordination, and voice projection. Support groups and counseling. Living with Parkinson's disease can be emotionally challenging. Joining a support group or seeking counseling can provide a safe space to share experiences, gain support, and learn coping strategies. Mental health support is an essential component of overall well-being. It is important to remember that each person's journey with Parkinson's disease is unique, and what works for one individual may not work for another. It is important to explore different strategies and therapies to find the combination that works best for you. Working closely with a healthcare team that specializes in Parkinson's care can provide invaluable guidance and support throughout this process. Frequently asked questions about Sinemet and Parkinson's disease. Is Sinemet a cure for Parkinson's disease? Sinemet is not a cure for Parkinson's disease. It is a medication that helps manage the symptoms associated with the condition and provides relief from tremors, stiffness, and slowness of movement. It does not slow down the progression of the disease or reverse the underlying neurodegeneration. How long does it take for Sinemet to start working? Sinemet typically has a rapid onset of action, with many patients experiencing symptom relief within 30 minutes to an hour after taking the medication. However, the exact timing can vary from person to person. Can Sinemet be used in combination with other Parkinson's medications? Sinemet can be used in combination with other Parkinson's medications, depending on individual needs and symptom control. It is important to work closely with a healthcare provider to determine the most appropriate medication regimen based on individual circumstances. Can Sinemet cause dyskinesias? Prolonged use of Sinemet can sometimes lead to dyskinesias, which are involuntary movements that may occur as a result of prolonged exposure to levodopa. It is important to work closely with a healthcare provider to find the right dosage and balance to minimize these side effects. Can Sinemet be used during pregnancy or breastfeeding? Sinemet should be used with caution during pregnancy and breastfeeding, as there is limited information available on its safety in these situations. It is important to consult with a healthcare provider for guidance and to weigh the potential risks and benefits. Real-life success stories of patients who have experienced improved mobility with Sinemet. Sinemet has provided hope and improved mobility for countless individuals living with Parkinson's disease. Here are a few real-life success stories from patients who have experienced the benefits of Sinemet. John's journey to better mobility. John, a 62-year-old retiree, was diagnosed with Parkinson's disease 5 years ago. His symptoms progressively worsened, making it challenging for him to perform daily tasks and enjoy hobbies like gardening. After starting Sinemet, John noticed a significant improvement in his mobility. He regained control over his movements, allowing him to continue pursuing his passions and maintaining an active lifestyle. Mary's triumph over freezing episodes. Mary, a 55-year-old teacher, experienced freezing episodes that severely affected her mobility. Simple tasks like walking through doorways or turning around became major obstacles. With the help of Sinemet, Mary was able to regain her mobility and overcome these freezing episodes. She now enjoys the freedom of movement and independence that she had feared losing. Robert's renewed confidence. Robert, a 70-year-old artist, had been living with Parkinson's disease for over a decade. His symptoms had gradually worsened, leading to a loss of confidence in his ability to paint and create art. After starting Sinemet, Robert experienced a remarkable improvement in his mobility and dexterity. His hands became steady, allowing him to continue pursuing his passion for art and expressing himself through his paintings. These success stories highlight the transformative impact that Sinemet can have on mobility and quality of life for individuals with Parkinson's disease. While each person's experience may vary, the potential for improved mobility and independence with Sinemet is a beacon of hope for those navigating the challenges of Parkinson's. Conclusion: empowering Parkinson's patients to navigate their journey to better mobility with Sinemet. Living with Parkinson's disease can be a challenging journey, but with the help of medications like Sinemet, individuals can regain control over their motor functions and enhance their mobility. Sinemet's unique combination of Carbidopa and Levodopa replenishes dopamine levels in the brain, providing relief from tremors, stiffness, and difficulty with movement. By understanding the mechanisms of Sinemet, considering its potential side effects, and following appropriate dosage and administration guidelines, individuals with Parkinson's can make informed decisions about their treatment options. Additionally, incorporating lifestyle changes, complementary therapies, and seeking support from healthcare professionals can further optimize mobility and enhance quality of life. Remember, each person's journey with Parkinson's disease is unique, and finding the right combination of treatments may take time and experimentation. By staying proactive, informed, and empowered, individuals with Parkinson's can navigate their journey towards better mobility with Sinemet and embrace a life of increased independence, mobility, and well-being. Thanks for watching.